They are both dental restorations that help improve function and enhance aesthetics. Composite is basically a resin. It's a softer material, and we don't usually need any sort of preparation in order to place the composite onto the tooth, to basically bond it onto the tooth. Very rare cases do need some sort of preparation, but it's not usually the case, whilst the veneers are made out of ceramic, a much stronger material, and we do need minimal preparation in order to place them. It's very case dependent. We usually carry out a consultation to determine if you're suitable for any of these treatments, but obviously the first thing that comes into mind is that the teeth need to be healthy and the gums need to be very healthy and strong. So we need to reestablish the oral health first, and then we can look into any sort of cosmetic treatment. It shouldn't hurt. We usually use a special numbing gel, and we make sure everything is fully numb before we start prepping the veneers. For bonding, in most of the cases, we don't really need to numb up because there's no discomfort. And in terms of sensitivity, you shouldn't expect any because we're working with enamel, and that shouldn't cause any sort of discomfort or sensitivity. In terms of durability, composite is much softer, it's a resin. It's supposed to last between 3 to 5 years. Now, the new materials on the market are much more promising, and if all the protocols are followed by the book, you should be getting better and better results. They obviously need to be maintained. In terms of the porcelain, they should be lasting about 10 to 15 years. Studies show even longer lasting veneers than that, but it really depends on the case selection and how well the patient is maintaining them afterwards. We obviously need to have very strong gums, so interdental cleaning is very, very important. Also, coming back to your dentist for the regular 6 months checkups, protecting your restorations, it's a very important step. By this I mean wearing a night guard if that was prescribed by your dentist, just to offer them the best chance to last as long as possible. Composites are more prone to staining and wear. As I said, it's a slightly softer material. However, if you follow a simple routine of cleaning interdentally with a soft brush as well, and if you visit your dentist regularly, they can usually polish and make sure the composite is smooth enough so it won't catch any bacteria or staining. So with composites, it's really a case of maintaining them long term and having this routine of going back and having them polished regularly. Not necessarily. So straightening the teeth, it's really the gold standard. We're usually starting with getting the teeth into the right position, and then we start to restore them. But there are instances in which the teeth have the right shape, they don't have any signs of wear. So if we align them and get a really good bite, other adjustments like bonding might not be needed. The very first step in making sure someone is suitable for either veneers or composite bonding is to make sure the teeth underneath are healthy, which means no decay, no signs of the nerve being affected, and very healthy gums and bone around them. Grinding your teeth is one of the red flags in case someone is considering veneers or bonding, but that can be addressed with some splints, either pre-treatment or splints, again, night guards at the end of the treatment, just to protect the restorations. Repairing a veneer is possible. Now, we all know that a repair is not as good as a new product. Sometimes replacements can be made, or if a veneer fractures or takes away a very little bit of the tooth, that might be replaced with a crown. It doesn't usually happen if all the steps are followed and the case selection is right. In very rare cases, it does happen.